The OPERON Orthopedic Extension. The OPERON Orthopedic Extension can be used with the OPERON D850, D820, and the D760. When using the D820 or D850, first slide the tabletop all the way to the foot end. This is not necessary when using the orthopedic extension with the D760. You may remove the head section to give the anesthesiologist better access to the patient, but you cannot articulate the back section vertically. Alternatively, remove the back section and attach the head section to the seated section. This allows vertical articulation of the head section for difficult airway cases. Next, remove the leg section by depressing the locks on the underside of the section. Reverse the table pad on the seat section to cover the perennial cutout. A filler plate may also be used to fill the panel cutout to provide more rigidity for the patient during the procedure. Using the hand pendant, lower the leg section so that the leg spars are not obstructing the orthopedic attachment. Position the orthopedic attachment cart at the foot of the table. Raise or lower the table so that the orthopedic attachment adapter is level with the table's side rails. Once attached, tighten the adapter screw to the table side rails. Make sure the release latches are completely latched over the side rail post. Once the orthopedic attachment is secured, raise the table to allow removal of the cart. Next, raise the leg section slightly on the hand pendant. This will remove play or looseness between the adapter and the table. The unaffected or well leg can be positioned using a go-bull knee support, stirrup, or an additional traction boot device, depending on the patient's mobility and surgeon preference. If another accessory besides the traction boot device is used for the unaffected leg, remove the leg spar by releasing this flap and lifting the leg spar away from the table. The released carbon fiber leg spar can then be placed back on the cart. The next step will be to apply the patient transfer board to the orthopedic attachment. The transfer board can be secured to the left, the right, or in the center of the orthopedic attachment using the adapter slots in the horizontal face of the attachment. You can now apply the carbon fiber sacral seat section to the orthopedic attachment using the 4 slots at the top of the adapter plate. The traction post fits securely into the hole on the sacral seat. Attach the traction device to the carbon fiber leg spars using a supplied clamp. The boot connects to the traction device with a knob adapter. Insert the boot and slowly turn until you hear the knob click into place. Each boot has 4 overlapping straps to secure the patient's foot during the procedure. The OPERON orthopedic attachment allows for gross traction and finite traction to optimize patient positioning during the procedure. The gross traction is managed here, going distally to or from the patient on the leg spars. Finite traction is adjusted here. Once the patient is intubated and before securing the gross traction completely, please note that you must allow enough travel for finite traction. Once both legs are positioned properly and securely, remove the patient transfer board. Loosen the large knob under the leg spars to abduct or adduct the legs from the midline of the patient. Loosen the smaller knob to allow the leg spars to slide along the track, helping with exposure of the affected leg's femoral head. Drape support poles can be used by attaching the supplied clamps to the table and the orthopedic attachment. Tighten all joints on the orthopedic attachment as desired for stability and safety. Next, apply the supplied leg support to the distal end of the leg spars and tighten the knob for the height adjustment. Once the surgery is complete, reapply the patient transfer board to the orthopedic attachment to support the patient's legs. Remove the carbon fiber traction post from the sacral seat section. Remove the legs from the leg supports and return to the patient transfer board. Remove all attachments from the carbon fiber leg spars. Remove the attachment from the table by raising or lowering the table so it's level with the cart. Slide the carbon fiber leg spars into the attachment cart. Next, slightly lower the leg section of the table. This releases pressure on the release latches for easier removal. Loosen the adapter screws and release the attachment from the side rails. Undock the orthopedic attachment by pulling the cart away from the table. For more information about the orthopedic extension accessory or to order replacement parts, please contact Berchtold Technical Support at 1-800-243-5135 option 2 or visit us at berchtold.biz.